Germ-filled drops of liquid blow everywhere when a sneeze or cough isn't covered. Just how far those drops can blow was not known until now. I'm Erin White with your latest health news. Coughs and sneezes spread respiratory diseases from infected people to people who are susceptible to the germs. To help understand the spread of germs by sneezes and coughs, a research team from MIT found that coughs and sneezes actually produced clouds of droplets that stayed airborne long enough to reach ceiling ventilation units. A report on the research stated that this could mean that ventilation systems may be more likely to transmit potentially infectious particles than had once been thought. Sneeze or cough into a disposable tissue, then wash hands thoroughly to help protect yourself from disease.
More women are choosing an aggressive treatment option for a diagnosis of breast cancer, and this trend is rising fastest in a certain group of women. I'm Shelby Cullinan with your latest health news. To track trends in treatment of early-stage breast cancer, a research team reviewed a large database of information to find which type of surgery women chose as their treatment. The results show that when cancer was found in one breast, more young women than in previous years were choosing to have both breasts removed. The authors of the study wrote that the chance of getting cancer in the other breast was only 3% in 5 years and 6% in 10 years. They also explained that these rates have been dropping due to the development of more effective treatments. Ask your oncologist about breast cancer treatment options.
Multiple sclerosis or MS symptoms vary widely among those with the disease, and that can complicate efforts to prescribe the right treatment for MS patients. I'm Erin White with your latest health news. According to a new analysis, a steroid called methylprednisolone is commonly used to treat the extreme fatigue, lack of mobility, and other symptoms of MS, and remains the most effective treatment. But steroids can have serious side effects, which may include diabetes, high blood pressure, and osteoporosis. The same analysis concluded that other kinds of medications, like glatiramer, acetate, and interferon B, some with milder side effects and some with severe side effects, may be treatment options for certain patients. Ask a doctor about the safest and most effective treatment for your condition.
Allergies is an immune system disorder that occurs when the immune system is overly sensitive to certain non-disease-causing substances called allergens. Allergies can be described as a false alarm of the immune system. Allergies can cause a variety of minor symptoms, including runny nose, itching, swelling, or sneezing. However, some severe allergies can cause hives, trigger asthma attacks, or create life-threatening breathing problems. Some common allergens include pollen, pet dander, insect stings, certain food, and certain medication. Family history of allergies, a lack of early childhood exposure to allergens, and young age may increase the risk of developing allergies. Treatments include many over-the-counter antihistamines, including cetirizine, fexofenadine, and loratadine. Prescription steroids, including prednisone and methylprednisolone, have also been used to treat severe allergies. Allergy shots, also known as desensitization therapy, is often effective at preventing allergies. The easiest way to prevent allergies is to simply avoid the offending allergen. Wash hands and clothes thoroughly after touching a known allergen. Know and avoid drug and food allergies and exercise caution whenever there is a chance you may be exposed to serious allergy triggers.
You expect food to nourish you, not to make you ill, but foodborne illness remains a problem in the U.S., as a new study has shown. I'm Shelby Cullinan with your latest health news. This new study from the CDC looked at preliminary data for 2013 to examine trends in these illnesses during the last year. Salmonella infections, the most common type of foodborne illness, is often transmitted through foods with an animal origin, like meat, milk, or eggs, but any food can become contaminated with bacteria. Whereas Vibrio bacteria are usually transmitted through raw or uncooked seafood. The study found that rates of foodborne illness in the U.S. largely stayed stable in 2013. But while salmonella infections decreased, illnesses caused by the bacteria Vibrio saw a big jump. Make sure your food is cooked and cleaned thoroughly before eating.
Sjogren's syndrome is a chronic condition of the immune system that causes mucous membranes and moisture-secreting glands to function improperly. However, could the disease also affect major organ function? I'm Sonia Singh with your latest health news. A recent study has found that pulmonary arterial hypertension, or PAH, known to cause high blood pressure in the arteries in the lungs, is more common among patients with primary Sjogren's syndrome. The patients found to have PAH were all young females and had primary Sjogren's syndrome for a shorter amount of time. Speak to your doctor to learn more about Sjogren's syndrome and its treatments.
Measles and polio may be thought of as from another time, but it wasn't too long ago that they were major issues for U.S. children. One vaccination program may be largely responsible for the improvement. I'm Erin White with your latest health news. A new study from the CDC focused on changes in vaccine coverage since a national vaccination program began 2 decades ago. The researchers estimated that over 300 million childhood illnesses were prevented in the U.S. during this time, thanks to routine childhood vaccinations. These avoided illnesses included an estimated 3,000 avoided cases of tetanus and over 70 million avoided cases of measles. The researchers also estimated that this saved around $295 billion in direct medical costs. Speak with your child's pediatrician about vaccinations.
Vaccines are designed to protect against disease, but babies cannot get most vaccines until they're 2 months old, leaving them vulnerable. A vaccine during pregnancy may help. I'm Shelby Cullinan with your latest health news. A recent study found that giving mothers a vaccine against whooping cough during pregnancy increased their baby's protection against the disease after birth. The vaccine is called Tdap, which stands for tetanus, diphtheria, and acellular pertussis. The newborns whose mothers received the Tdap during pregnancy had more antibodies against whooping cough than the babies of mothers who received the Tdap after giving birth. Ask your OBGYN about the Tdap vaccine during pregnancy.
Childhood obesity has gotten plenty of attention, but are behaviors that may prevent it really changing? I'm Erin White with your latest health news. A new report explored the state of physical activity among U.S. youth. According to the National Physical Activity Plan Alliance, the U.S. 2008 Physical Activity Guidelines recommend that children between the ages of 6 and 15 get at least 60 minutes of moderate to vigorous physical activity 5 days of the week. However, the report found that overall, only around a quarter of these children are meeting this recommendation. The report also estimated that on average, U.S. children spend more than 7 hours a day on sedentary activities, a number that increases as they get older. Speak with a pediatrician about your child's level of physical activity.
Poor diet can contribute to the risk of developing type 2 diabetes, but which is the right diet to reduce that risk? I'm Shelby Cullinan with your latest health news. People with type 2 diabetes have high blood sugar because their bodies do not use insulin effectively to reduce the blood sugar levels. Results of a recent study have shown that several healthy diets, including the DASH and Mediterranean diets, can reduce the risk of developing type 2 diabetes. These diets emphasize vegetables, fruits, whole grains, beans, seeds, nuts, and healthy fats, as well as certain types of lean meats, fish, and low-fat dairy products. Ask your doctor how to cut your diabetes risk.
About 1.5 million people around the world are currently on hemodialysis, an artificial blood filtering treatment for kidney failure. This treatment is known to impact patients' physical function, but they may have more control than they realize. I'm Erin White with your latest health news. A recent study found that hemodialysis patients with more muscle mass had better physical function compared to hemodialysis patients with low muscle mass. The researchers suggested that physical activity that builds muscle mass may be associated with better overall health and quality of life for hemodialysis patients. Discuss an appropriate physical activity regimen with your doctor.
For many, using aspirin can be a huge help when it comes to fending off a headache and reducing the risk of a heart attack. However, could aspirin also help lower the risk of a certain type of cancer? I'm Sonia Singh with your latest health news. A new study funded in part by the National Cancer Institute has found that people who carry a particular gene may reduce their risk of colorectal cancer by taking aspirin. The study focused on over 200 colon cancer cases that developed over the course of 3 decades. Although research is ongoing, researchers concluded that doctors could safely take a biopsy from the colon during a colonoscopy to determine which individuals would benefit from a daily low-dose aspirin regimen. Speak with your doctor to learn more about the benefits of aspirin.
Lice are parasitic insects that can sometimes be found on the heads and bodies of certain patients. Lice can cause intense itching and small red bumps on the scalp, neck, and shoulders. In addition, lice eggs or crawling lice may be visible in the hair or on the skin. There are 3 common forms of lice, including head lice, body lice, and pubic lice, sometimes known as crabs. Lice are easily spread through close personal contact and by sharing belongings with people who have lice. Even though lice most typically affect school children, lice can affect people of all ages. Lice are not spread by pets, nor can they hop or fly to new hosts. Both over-the-counter and prescription medications are available to treat cases of lice. Over-the-counter medications like Nix and Rid are available as shampoos, lotions, and rinses. Prescription medication, including Sklice, is available as well for cases that are hard to treat. Keep people with lice away from others until they can be properly treated. Maintain proper hygiene to avoid lice. Always remember to wash all clothes and bed sheets with hot water and detergent if you find someone close to you has had lice, as lice can sometimes survive on household items for long periods of time.
Untreated appendicitis can have serious consequences, but surgery may not be the only option for children with the condition. I'm Erin White with your latest health news. Appendicitis occurs when the appendix becomes inflamed or infected, swollen, and painful. Researchers found that appendicitis was successfully treated with antibiotics in almost all of the children who were treated with them. This treatment meant kids could return to school sooner and felt better than the children whose appendicitis was treated with surgery. Speak with a doctor about the risks and benefits of different treatment options.
Many people drink caffeinated drinks like coffee or tea on a daily basis. It's possible that even small changes in coffee consumption could affect their health in a major way. I'm Shelby Cullinan with your latest health news. A recent study found that people who increased their coffee consumption by more than 1 cup per day over a 4-year period were 11% less likely to develop type 2 diabetes in the following 4-year period compared to people who did not change their average coffee consumption. The findings reveal that these increases and decreases in type 2 diabetes risk were only associated with caffeinated coffee. Discuss your daily coffee consumption with a doctor. By translating health information into a consistent, easy-to-understand language, the Daily Rex News Network enables you to take control of your health. Sign up for the Daily Rex newsletter to receive the latest health news and videos right to your inbox every morning. For trusted, research-based health news, join us at dailyrex.com. Your health starts here.
For those with chronic high blood pressure, keeping healthy is essential. Exercising and maintaining a healthy diet can delay or prevent diabetes. These interventions can even save lives. I'm Sonia Singh with your latest health news. Prediabetes is constantly high blood sugar that isn't quite high enough to qualify as diabetes. A study was conducted with patients who have this condition, some of which were assigned to a diet or exercise intervention, while others received standard medical treatment. Following up 20 years later, the intervention group had significantly lower rates of death from all causes and from heart disease, as well as lower rates of diabetes. Speak to your doctor about diabetes prevention and treatment.
Osteoarthritis is the most common form of arthritis that results from a breakdown of cartilage around the joints. Healthy cartilage usually absorbs the shock of movement and activity, but when cartilage is lost, the bones are able to grind against each other. This can occur in any joint, but usually occurs in the hands, knees, hips, or spine. As osteoarthritis worsens, it can cause pain, swelling, and reduced motion in the joints. Over time, osteoarthritis can cause permanent damage to the bone and even make walking and other daily activities difficult. Osteoarthritis usually happens gradually over time. Some risk factors that might lead to osteoarthritis: being overweight, getting older, joint injury, joints that are not properly formed, a genetic defect in joint cartilage, stresses on the joints from certain jobs and playing sports. Osteoarthritis occurs most often in older people. Younger people sometimes get osteoarthritis primarily from joint injuries. Doctors often combine treatments to fit a patient's needs, lifestyle, and health. Treatment may include exercise, weight control, rest and joint care, non-drug pain relief techniques to control pain, and even surgery. Medications include acetaminophen and NSAIDs such as ibuprofen. Lifestyle changes, including weight loss, gentle exercise, and hot and cold packs, can help reduce pain and sometimes slow down the progress of osteoarthritis. Some supplements containing glucosamine and chondroitin may also help with joint health.
Diabetes during pregnancy can mean complications to the infant before and after birth. It's much less clear what these babies may face when it comes to long-term health issues. I'm Shelby Cullinan with your latest health news. A research team reviewed published scientific studies to find evidence of the long-term effects on offspring born to mothers who had diabetes while they were pregnant. Their review found studies in which women with diabetes had offspring with an increased incidence of obesity and diabetes as children and adults. Speak to your doctor about controlling diabetes during pregnancy.
No vaccine is completely effective, so it's helpful to understand how effective different vaccines are when people decide whether to get vaccinated. Until now, there has been little information about the flu vaccine's effectiveness for children. I'm Erin White with your latest health news. A new study found that the flu vaccine is effective in children under 5 years old, and particularly for children under 2 years old. The flu vaccine is recommended for all children aged 6 months and older by the Advisory Committee on Immunization Practices at the CDC. Children getting the flu vaccine for the first time may be recommended to receive 2 doses, at least a month apart, to receive as much protection as possible against the flu. Ask a pediatrician about the flu vaccine and your child.
Diabetes increases the likelihood of having heart disease. While blood pressure medications may help reduce related risks, some therapies may be more effective than others. I'm Shelby Cullinan with your latest health news. 2 blood pressure lowering therapies, angiotensin converting enzyme or ACE inhibitors and angiotensin II receptor blockers or ARBs, are commonly used to lower the risk for heart disease in diabetes patients. A new study has found that ACE inhibitors may effectively reduce the likelihood of heart attack and death among these individuals, while ARBs may not influence those outcomes. Discuss the benefits of different blood pressure medications with a physician.
When it comes to medical testing, a person's weight can affect the accuracy of the test results. A recent study looked at whether or not weight affects the test results when testing women to determine if breast cancer has spread. I'm Kendra Rowland with your latest health news. This study looked at whether ultrasounds could effectively detect breast cancer in obese women's underarm lymph nodes. Researchers found that ultrasounds were just as effective at looking for breast cancer in overweight or obese women as in women with a normal weight. Additionally, ultrasounds were more accurate among overweight and obese women when it came to negative findings, determining that there was no cancer. Speak with your doctor about breast cancer screening.
Here's another reason to make whole grains and vegetables a part of your diet. Getting enough dietary fiber may be a life-changing health decision for people who've had a heart attack. I'm Erin White with your latest health news. Fiber is commonly found in vegetables, fruits, beans, legumes, and whole grains. Recent research looked at the link between dietary fiber consumption and death in people who had previously had a heart attack. The researchers found that participants who ate the most fiber had better survival odds than those who ate the least. They noted that dietary fiber from cereals provided the strongest protection against death. Get your daily recommended amount of dietary fiber.
Asthma affects millions of children in the U.S., making it the most common chronic condition among children. And the air around the homes of some children with asthma may be affecting their condition. I'm Shelby Cullinan with your latest health news. A recent study found that traffic-related air pollution was tied to increased odds of white children being readmitted to the hospital for asthma within 12 months of initially being hospitalized for the same condition. Air pollution exposure and hospital readmission were not significantly linked for African American children. The findings suggest that other social and environmental factors not considered in this study came into play. Speak to a pediatrician if you live in a high-traffic area.
Consuming lots of sugary drinks can expand your waistline, but you may not be aware of what it also might do to your blood pressure. I'm Erin White with your latest health news. Sugar is added to many food products, but the largest source of added sugar we consume is in sugar-sweetened drinks. Drinking sugar-sweetened beverages has been linked to obesity, high blood sugar, heart disease, and kidney stones. Recently published research found it was also associated with increased blood pressure and a greater risk for developing hypertension. The studies that researchers analyzed showed a 26 to 70% increased risk of developing high blood pressure in people who consumed sugar-sweetened beverages compared to people who did not drink sugar-sweetened beverages. Speak with a doctor about healthy blood pressure levels and limit your consumption of sugar-sweetened beverages.
Psoriatic arthritis is a joint problem that often occurs with psoriasis, an immune system disorder that causes red, itching skin. Psoriatic arthritis occurs when the immune system begins to attack healthy cells in and around the joints. Psoriatic arthritis causes pain, stiffness, and swelling of the joints, and can often cause significant fatigue that does not go away with rest. Psoriatic arthritis is usually mild, but some serious cases can affect and even damage multiple joints. In patients with psoriasis, age and family history may increase the risk of psoriatic arthritis. There is no cure for psoriatic arthritis, but certain medications can help control inflammation, pain, and damage to joints. Non-steroidal anti-inflammatory drugs, otherwise known as NSAIDs, corticosteroid injections, and methotrexate are often effective in relieving symptoms. Treatment may also include physical therapy and gentle low-intensity exercise. In some cases, surgery may be needed to repair or replace damaged joints. Managing psoriatic arthritis can become a lifelong challenge. Certain lifestyle choices include a healthy weight and physical activity. These seem to reduce symptoms. Cold and hot packs and proper fitting footwear can also make a difference for some patients.
Drinking alcohol or smoking has been shown to increase the risk for esophageal cancer, and enjoying the two vices together might raise that cancer risk even further. I'm Shelby Cullinan with your latest health news. Esophageal cancer is cancer of the tube that carries food and drink to the stomach. while the combined effect of drinking alcohol and smoking increased the chance of developing esophageal cancer. Researchers reported that when the two habits were taken together, the cancer risk was greater than having either habit on its own. The researchers recommended that the intake of alcohol and the use of tobacco be reduced as much as possible. Tell your doctor if you drink alcohol or smoke.
COPD causes difficult breathing, which can lead to anxiety and insomnia. A new study says a common type of medication used to ease these symptoms may not be the best option for those with COPD. I'm Erin White with your latest health news. This new study showed a significant increase in the risk of COPD patients having a severe respiratory event, such as shortness of breath or fits of coughing, when prescribed a benzodiazepine medication. Study data showed that COPD patients who used benzodiazepines were 45% more likely to experience respiratory-related side effects than the group not taking benzodiazepines, as well as 92% more likely than the benzodiazepine-free group to require emergency room treatment caused by increased severity of their COPD symptoms or the development of pneumonia. Speak with a doctor about your COPD symptoms and medication that is safe and effective for your condition.
Diabetes is a condition where blood sugar levels remain higher than normal. There are two main types of diabetes. In type 1 diabetes, the body attacks cells that normally produce insulin. In type 2 diabetes, the body does not make or use insulin the way it should. Insulin is a hormone that helps the body use sugar for energy. In diabetes, problems with insulin causes sugar to stay in the blood. Another form of diabetes that mainly affects pregnant women is known as gestational diabetes. Symptoms of diabetes include increased thirst, frequent urination, fatigue, blurred vision, frequent infections. Age, family history, race, diet, and lack of exercise may increase the risk of developing diabetes. Over time, having too much glucose in the blood can cause damage to the eyes, kidneys, and nerves. Diabetes is also a risk factor for many other conditions, including infection, heart disease, and liver problems. There are many different medications that can help treat diabetes. Oral anti-diabetic medications like metformin and glipizide are effective in keeping blood sugars in check, and injectable insulins are often used to help the body use blood sugars normally again. Eating a healthy diet, maintaining a healthy weight, and exercising can help control diabetes. It's important for diabetics to routinely check their blood sugars, take medications on time, and get regular checkups to watch out for complications.
We tend to think of football players as healthy and strong, but a new study suggests that they may be prone to future heart troubles. I'm Shelby Cullinan with your latest health news. This study compared college football players to other college students who did not play the game. The study found that though the non-players had higher blood pressure, the football players had stiffer arteries, a possible sign of heart problems down the line. Speak to a doctor about protecting yourself while exercising.
E-cigarettes have become a popular fad among smokers and have often been used as a substitute for regular cigarettes. Yet the debate surrounding them has grown, and now rules governing the products may become stricter. I'm Kendra Rowland with your latest health news. The FDA has proposed that e-cigarettes and other tobacco products would fall under their regulation. The FDA currently regulates certain tobacco products, including cigarettes, roll-your-own tobacco, and smokeless tobacco, but not others. The proposed change would extend this regulatory authority to include additional products. The rules would require e-cigarettes to include health warnings and only make health claims confirmed by the FDA. Speak with your doctor about healthy ways to quit smoking.
Celiac disease is not common among children, but it may have been underdiagnosed until recent years. Knowing risk factors for it may help parents. I'm Shelby Cullinan with your latest health news. A recent study was conducted of nearly 1,000 children in Italy who were assessed for stomach problems. The children were classified as having either irritable bowel syndrome, abdominal pain, or upset stomach indigestion. The study found that children with irritable bowel syndrome are 4 times more likely to have celiac disease than children without irritable bowel syndrome. These findings mean that parents of children with irritable bowel syndrome may want to ask about screening for celiac disease. Ask your pediatrician about celiac disease screening.